Welcome back to the deep dive. Today we're really getting into something vital for international doctors aiming for Germany.
Yeah, we're looking at Lesson 4 from Module 0 of the ArztWerden course. It maps out some really fundamental steps you encounter after you actually arrive.
Okay, so let's unpack that. We're zeroing in on the big milestones this lesson talks about, right?
Yeah.
The exams, applications, getting started in a clinic.
Exactly. Our mission here is pretty straightforward. Pull out the key info from this lesson about the Fachsprachprüfung, the FSP, the Kenntnisprüfung KP, then the application stuff, and that initial clinic start.
Just the essentials from this text.
Right, to give you a clear overview based purely on what's presented here.
Think of it as a first look based on the specific material. If this is your path, knowing these points is, well, pretty crucial.
Definitely.
So let's dive right in. The lesson points to the Fachsprachprüfung, the FSP, often being the first major thing. What's the core idea here, according to the text?
Well, the lesson really stresses that the FSP is about showing you can communicate safely and clearly, with patients, their families, colleagues.
In German, obviously.
In German, yes. Specifically aiming for that C1 level needed for medicine. It's presented as your basic linguistic key.
And the source material gets specific about what the exam actually feels like.
It does. It mentions simulating real situations.
Like day-to-day stuff.
Yeah, exactly. Like taking a medical history or explaining something medical to a patient, writing a doctor's letter. The focus seems to be on applied language, not just, grammar rules in isolation.
Okay, and this lesson has a story, right, about a Dr. Ramirez. That seemed important.
Ah, yes. That little anecdote is quite revealing, I think. It's a key insight from this lesson. This Dr. Ramirez apparently really focused on the technical term.
Knew all the words.
Seemingly, yes. Grammatically perfect, maybe. But the feedback, according to the story, was that he came across as distant. Used jargon the patient in the exam didn't understand. And crucially, didn't really ask about the patient's own worries or concerns.
So the lesson isn't just saying, learn the medical dictionary.
Not at all. That example really hammers home the point that, yes, you need the specialized vocabulary, but it has to be part of empathetic, patient-level communication.
So it's how you say it, too.
Exactly. The lesson underlines that knowing the terms isn't the whole picture. You need to use them effectively, appropriately, in a real dialogue. How you communicate matters just as much.
That definitely puts a different spin on it. Practical, empathetic communication. That story makes it very clear. Okay, so beyond language, there's the medical knowledge itself. The Kenntnisprüfung, the KP, the lesson frames this as pretty decisive for many people.
Yes, the text suggests the KP is often that make-or-break step for doctors from third countries needing the full license, the approbation.
And why is that?
Its purpose, as described here, is to check if your medical knowledge and your clinical skills are genuinely equivalent to a German medical graduate's.
Okay. And what does the lesson say about how it's usually run?
The format. It typically describes it as an oral practical exam.
Hands-on, then.
Seems like it. The main focus areas mentioned are internal medicine and surgery. But it also notes that related subjects often come up, things like emergency medicine, pharmacology, maybe interpreting imaging.
So what's the ultimate skill they're testing based on this source?
The goal is really about demonstrating your clinical reasoning. Can you analyze complex patient cases? Can you arrive at a solid diagnosis? Can you map out a treatment plan?
Stuff you do every day in a hospital.
Exactly. It's set up to mirror that process, showing you're ready to function effectively as a doctor within the German system.
Right. Okay, so language, knowledge, then comes the practical part. Getting a job or even an observership, the application process. How critical is this step, according to the lesson?
The lesson paints your application, your Bewerbung, as your essential ticket.
Your way in.
Pretty much. It's what gets you considered for things like a hospitation and observership, or maybe a preparatory role while you're still working towards a KP, or eventually your first proper job with the full approbation.
And are there specific German standards for this mentioned?
Yes, the text does highlight that Germany has particular expectations for resumes the Lebenslauf and cover letters, the Anschreiben.
What makes them effective based on this material?
Well, for the Lebenslauf, it needs to be thorough, ideally without unexplained gaps, and really clearly laid out.
Easy to follow.
Right. And the Anschreiben, the cover letter, that's really key. The lesson stresses it must show genuine motivation for that specific job at that specific hospital.
Not just a generic letter.
No. You need to clearly explain why you're a good match, what skills and value you specifically bring to their team.
The lesson uses an analogy here, doesn't it?
It does. It calls your application your business card,
Meaning?
meaning it has to be sharp, professional, and make a really strong first impression. It needs to shine.
Makes sense. Okay, finally, the lesson touches on actually starting work in a clinic, which might happen at different stages, right? Not always after full approbation.
That's a good point the text makes. You might start with an observership, or maybe working under supervision with a temporary license, a Berufserlaubnis, even before you get the final approbation.
But entering the clinical environment itself is a big step regardless.
Absolutely. The lesson presents it as a significant transition whenever it happens.
So what does the lesson suggest you might run into when you first start?
It gives a few examples.
Yeah.
You'll likely encounter different hospital hierarchies, maybe clinical procedures that are new to you, getting used to digital record systems, and just figuring out the daily flow, working within the team, interacting with patients in that specific setting.
And what's the recommended mindset for navigating that, according to this lesson?
The text strongly emphasizes being open and really willing to learn. And crucially,
Yes.
it advises you to ask questions. Whenever you're unsure about something, just ask.
Don't just guess or stay quiet.
Exactly. The lesson points out that your colleagues will know you're new, they expect you to learn. Asking questions is normal, expected, and helps prevent misunderstandings or mistakes.
That's very practical advice. Be proactive, ask. Helps you settle in and, as the lesson implies, avoid some common pitfalls early on.
Definitely.
Okay, so let's quickly recap this deep dive based purely on the Art stored in Lesson 4 material we've discussed. We've looked at the 4 key milestones it lays out. The FSP for language.
Right, the KP for medical knowledge.
The importance of the application process.
And those first steps when you actually start working in a clinic.
This lesson clearly positions these as really distinct, important stages in the journey.
Crucial phases on the way to practicing medicine in Germany, as presented in this source.
And the lesson finishes by posing a question really directly aimed at you, the listener. It asks you to think. Out of these 4 areas described, FSP, KP, clinic start, application, which one, right now, causes you the most concern?
Yeah, which one feels the most unclear or maybe the most daunting to you at this moment?
It's a powerful reflection point. Taking this overview from the lesson and asking yourself that question
Can really help you focus your energy, figure out your next steps on what is, let's face it, a complex path. But one this lesson suggests is definitely achievable.
Absolutely. So take a moment with that. What stands out for you? Where you feel you need more clarity? That's the core question this lesson leaves you with.
And that really brings us to the end of this deep dive.